My name is Jim Tisdale. I'm a professor of pharmacy at the College of Pharmacy at Purdue University and an adjunct professor in the School of Medicine at Indiana University. The problem that we're addressing here is there is a life-threatening arrhythmia called torsade de pointe that can be associated with over 50 drugs that are currently on the market. It's a side effect of drugs. More than 50 commonly used drugs in the market can cause this, including antibiotics, antidepressants, antipsychotics, methadone, and many others. There's a measurement on the ECG, the electrocardiogram, called the QT interval, that is a marker of increased risk. We know that women are at higher risk than men, and we believe that that's related to the influence of sex hormones. There's some preclinical data that show that estrogen probably increases the risk, and we have conducted a study in the past that shows that progesterone in animals might reduce the risk. And so our current study is in human subjects, to determine if administration of oral progesterone can reduce the risk of drug-induced QT interval lengthening. So in our study we took 16 young healthy female volunteers. We randomized those healthy female volunteers during the menses phase of their menstrual cycle, when their hormone concentrations are at their lowest, and they were randomized in a crossover fashion to receive progesterone for 1 week or placebo for 1 week. At the end of each week of treatment, we brought the subjects into our clinical research center and we administered a small dose of a drug that can lengthen the QT interval. A dose that's small enough to lengthen the QT interval but not to be dangerous for the subjects. And the hypothesis was that in the progesterone phase, there would be a smaller increase in the QT interval associated with the drug ibutylide than in the placebo phase. What we found was that during the progesterone phase, the patient's ambient or natural QT intervals were shortened. And so progesterone shortened the natural QT intervals compared to the placebo phase. And then after we administered the ibutylide, progesterone attenuated or shortened the degree of QT interval lengthening associated with the drug. So in the progesterone phase, the QT intervals were shorter than they were in the placebo phase. And so we conclude that oral progesterone shortens the QT interval, the pre-treatment QT interval in young, healthy, premenopausal women, and oral progesterone administration also reduces the degree to which drug-induced QT interval lengthening occurs. And the clinical significance of this is, after some additional studies, that we potentially could administer oral progesterone to high-risk patients who need a QT interval lengthening drug to reduce their risk of having this life-threatening arrhythmia. This study was funded by a grant from the Midwest affiliate of the American Heart Association, and so it's a competitive grant process, but they funded this grant. They funded this clinical study that we did, and they also funded an animal study that's going along at the same time as this study.